RecoverRx. I'm here with my colleague, Dr. David.
Hello.
We're back for another episode of Curiosity Corner. We really enjoy doing these episodes. We've gotten a lot of great feedback from you listeners, tuning into them. Today, we're excited. We have a topic that we get a lot. I mean, we are certainly experts here in the field of shoulder rehab and shoulder diagnosis. And, a lot of our patients come to us with complaints of shoulder pain and they're not really sure what's going on. And a lot of the times it really comes down to them saying they saw someone, they saw a friend or the trainer, and they told them they have shoulder impingement. And that's really what it feels like. So we just wanted to give some more clarity on really the different types of shoulder impingement that can occur and kind of how we evaluate and might even treat some of these issues. But we wanted to really provide some clarity on just that global term of impingement, and it just gets thrown around quite a bit. So, David, I'm curious.
There it is.
What is shoulder impingement?
Good question, my friend. Good question. Right. So one of the reasons why we want to bring this up is I feel this probably on a daily basis. Yeah. Right. So a patient may come in, they're here for an evaluation, and they have shoulder pain. And hey, I was at the gym. I was doing a bench press and I kind of felt pain in my arm. It happened a couple months ago and it hasn't got a little better. Googled it a little bit and went online and it looks like a rotator cuff issue. Talked to someone else. They say, oh yeah, I hurt my rotator cuff doing this. And a lot of people come in with this kind of preconceived. I have shoulder pain with bench press, overhead press, right? Maybe a quick clean position, and it just hurts on my shoulder, and I know it's my rotator cuff. Or they definitely ask questions about that.
Rotary cuff,
rotator, potato cup. We do hear different things with it, and that's one of the reasons we want to talk to you is like, how can we clear the mud and be specific and provide really clear guidelines to the general public, right? And so if you're my patient, you come in, you might be that same scenario. Hey, I hurt my arm, it hurts when I bench press. I think it's my rotator cuff. How do I, as a therapist, weed through all of that information and create a plan for you? Right? So the first thing we're going to say is it could potentially be the rotator cuff, right? And so what do we know about that tissue? It's the most important muscle probably to the stabilization of the shoulder. It's 4 muscle groups. 3 live in the back, 1 lives in the front, and it's very commonly injured, right? I think that's why you would agree with that as well. As like its job is to provide stability to the shoulder and to provide a good home from the shoulder. It does get injured frequently, so we do need to field that question. But what we need to do is, why is it injured? What are the influences to it that create this impingement type term? And then how does our treatment benefit you for your specific issue?
I would add on to that, we do need to screen if there's a major injury or major tear. Now, usually that's pretty obvious, but that's something that we want to really be aware of as well.
Well, what a good thing about that is, I wrote a blog that's titled, Should I Get an MRI for My Shoulder?
Did you?
I did. So check that out. We also did a video on that, and that's what we want to tie this into is, when you come in with shoulder pain, what's wrong with you, and then how can I fix you, right? And so if you have that concern, hey, I know I got rotator cuff impingement, how can I help you? Well, first, we're going to listen to what's going on, right? Where does it hurt? Hey, Luke, you have pain in your shoulder with lifting. Where does it hurt?
Yeah, like right up in here.
Right? So there's multiple different types of impingement that go on with the shoulder. And if I haven't said it already, think of impingement as just a narrowing of a position. Some structure is moving up against another structure, and it's creating a pain experience, right? The shoulder can get impinged right here, the top part of the AC joint, right underneath this area. Can be getting impinged in the front part, right? The coracoid process, right? You can have impingement where the bicep tendon gets caught underneath the AC joint, right? For the most part, you may care about that initial diagnosis, but what that does for me is it helps to create a treatment that's going to say, if a person has supraspinatus impingement right here, they may respond better to doing X, Y, and Z, a different treatment model, that someone that may have coracoacromial impingement, right? And they may have more difficulties in this position of the shoulders. The treatment's going to matter and going to be different based upon how the patient presents and what type of impingement we're dealing with. Does that make sense, Luke?
Yeah.
Right? And so it's creating a clear picture, identifying maybe the cause of the rotator cuff impingement, and that's going to help guide the treatment throughout the process.
Yeah. And I would say ultimately it really does come down to the role of the rotator cuff and its stabilization of the ball in the socket. And whether that impingement's in the front, top, or back, some of the exercises are going to be different based on where that's at. But ultimately, we need to educate and help facilitate the ability to engage the proper muscles and stabilize that shoulder. And I think patients come in with that fear of, am I doing an exercise that's going to create a tear, right? And
that's what I say all the time. And I think, like, to continue to talk on it, I think minimizing the fear, the most important thing we can give you is the correct diagnosis, right? And so I think that a lot of times we see, hey, I've stopped benching because I don't know if I'm causing more problems.
Right.
So what we're going to say is, one, let's create a clear picture of why it's getting impinged. Let's figure out how we can get you back to bench press, whether it's modification, whether it's through corrective exercise, whether it's through dry needling, manual therapy, opening up that highway, minimizing the consequence of impingement. But the diagnosis will help create the picture of, this is X, this is Y, this is Z, and here's what's going on with you.
Yeah, and we could talk on this all day, but ultimately, you got to have a clear diagnosis, like you said, and a good plan going forward. And that's what we provide as physical therapists, and especially in the performance realm. And as far as treatment goes, we have all sorts of different content on how we kind of treat the shoulder, which we can certainly link to this video, and you guys can kind of dig into the different methods of manual treatment. And David mentioned dry needling, we have Graston, we have soft tissue
blood flow restriction if the shoulder's really painful.
All sorts of different ways that we can kind of help facilitate this recovery. But ultimately, you got to have someone that's going to keep you accountable, and you're going to have to follow a plan so that you're doing the right things. And that's why we wanted to come on today and talk about this specific condition, and how we could help, or how a physical therapist can help you. So I encourage you guys to go out and kind of check out some of our additional content. If you have additional questions about shoulder impingement, how we evaluate, how we diagnose, or if you're having issues yourself, give us a call, and or reach out via email.
That's number one thing you can do, right? I mean, to take away on it, if you are fearful that you think you injured your rotator cuff, talk to us. Come in and don't just play that guessing game. I think I'm going to hurt myself if I did this. I think I injured my rotator cuff. Then your brain's going to think you're injured, right? So a lot of times you just need to clear a path. And we'll provide that for you based upon the different type of impingement that you do have for your rotator cuff.
Cool.
Awesome.
All right. I think that provides some clarity.
I'm glad you're curious.
Yeah. All right. Take care, guys.